What do we mean by digital technologies? Well, artificial intelligence, everybody's very excited and we have lots of projects, but we're really interested in real-time surgical data as well. We go into operations with a huge amount of data from our scans, from our patients, and then as the operation proceeds, this data starts to become obsolete and out of date. How can we improve that data repository in real time? We also want connected registries so that we have this feedback loop to our patients. What were they like before? What are they like during operations? And what are they like afterwards? And the last area really is extended realities, which is what I'll focus on. And I hope by the end of this very, very short presentation, I can show you that this isn't the preserve of fancy technology, expensive equipment, and sort of gamers. This is real bespoke patient care that's very precise and very achievable in our NHS. And really the lesson comes from the gym. So I started going to the gym last year, mainly because my kids started running up to me, sort of using my stomach as a drum and going bum bada bum bada bum. I thought, I need to do something about this. And I go to a council gym. So it's our local leisure centre, state funded. They've partnered with industry, Techno Gym, and they have all this equipment which has a QR code on it. You walk up to it, you point your phone, it asks you what you want to achieve, and it creates a bespoke training program for you that you then deploy. It gives you all the data in real time, it feeds it back to you, and then it modifies your next workout based on that. And I pay £24 a month for this. So you can see where I'm going. We can achieve a state-funded system that provides bespoke, precise intervention and gives you that real-time data. So this is one of our patients who in our consultation in clinic is wearing a headset and has been taken through their own scan. So this isn't just a model, this is their actual MRI scan, auto-segmented, showing their brain tumour. So I should have said at the beginning, I'm an academic neurosurgeon and my area of expertise or interest is in brain tumours. So now we're able to take away the brain and show them the tumour and the relationship to the important tracts in their brain. And this is really important because I feel sorry for some of our patients. We bring them in off the street and we expect them to understand brain tumours, tractography, why they should have their operations awake. And actually all of this helps them understand better. We've just completed a study and we're writing the manuscript up to show the effect of this. So this is me now taking that to the next step, pre-operative planning, standing in the equipment room of a theatre, quickly having a look at the surgery that we're about to perform, reminding myself of the tumour, reminding myself of the tractography, what we're going to be testing for with this patient awake. Taking this into theatre, we project all of that tractography onto the brain in real time. And we're actually able to now cut down our awake testing time because we know exactly where the tracks are. So I say to the speech and language therapist, I'm about to make this patient stop talking, and we do it. Before, we would have had to fumble around a little bit in the brain trying to find these tracks because we didn't have that real-time data. And all of this is a connected strand of data that runs right through the patient on a precise and bespoke basis. And what about recovery after surgery? We want our patients to recover quickly, but well. So there's a pressure to get our patients out, but we want them to go out well. And it's about trying to achieve that faster. These are some holographic programs that help patients to reconnect left and right brain centers, reconnect that sensory motor aspects of recovery after surgery. And some of you will have seen this video before, but this is one of our industrial partners, and we've had industrial partners right throughout this journey of trying to bring these innovations in. So this is one of our patients partnering with a company called SyncVR. We put the headset on, and the therapists help drive self-directed therapy. So can patients direct their own therapy while they wait for that precious resource, which is, of course, our physiotherapists, speech and language therapists, and occupational therapists. We know they are stretched. They're sometimes only able to offer inpatients 1 hour of therapy a day, while that patient lies in bed, unsafe to mobilize by themselves and sitting there for a whole day. Surely there's a way that we can maximize that in a virtual environment. And our patients love it. You know, they really enjoy it. It's really funny, actually. If you watch this video, our patient chooses the beach, which really shows you they're a Yorkshire patient. What's even better about this, really, though, is it's now being driven by the physiotherapists. I'm not the expert in neurorehabilitation. I'm not an expert in rehabilitation of any sort, really, but the therapists are. And they have gone from being slightly reluctant to actually badgering us, asking us, where's the kit? We need to get on with it. And they've completed the study. So we've just finished our phase 1 study showing feasibility. And again, that's in write-up now. So the extended realities is an example of a digital technology that is in clinical practice, that is bespoke to each and individual patient. Having a brain tumour is one of the most devastating diagnoses anybody can receive, and it comes out of the blue. The last thing patients need to grapple with is all of the scans, all of the recovery, and all of the fear around their operation. If we can make that journey a little bit better, a little bit easier to understand, and send them back out of hospital as the person they were when they came in, we would have done them a real good job. So I hope I've shown you that. You've heard about the ecosystem, so I don't need to talk about it again, but I can't tell you enough what it means to be in Leeds to try and do this work. Nobody has ever said no to any of these things. You know, people like David and V who just say yes and put up with all the crazy ideas and the, you know, bonkers sort of requests, but also the hospital, the innovation pop-up, the university, our Centre for Immersive Technologies, great support from NIHR and our industry partners. Thank you.